Menstrual health and hygiene, to me, is having a pad when I need it, being able to menstruate without being laughed at, without being discriminated against, being able to live with menstruation as a woman in dignity. Swiss Church Aid Uganda implemented the menstrual health management project through our partners, EPER Uganda, with the support of the Swiss Water and Sanitation Consortium, through the niche that we were piloting in Yumbe District in Bidibidi refugee settlement. The niche is Blue Schools, where we go beyond water and sanitation to provide menstrual health services to schools and learners. The project worked in 7 schools, where 4 of them were Blue Schools, and the non-Blue Schools benefited from access to sustainable water services, access to improved sanitation services, where we constructed latrines and provided rainwater harvesting tanks and pipeline extensions in Zone 4 and Zone 5 of Bidibidi refugee settlement. When Swiss Church Aid came to Bidibidi refugee settlement, where the MHM intervention was implemented, there was a lot of issues surrounding menstruation at that time. An estimated 50% of learners in our project-supported schools were missing 2 to 3 days of school per month. This resulted in over 27% of the school year missed due to lack of access to menstrual pads. However, when we started implementation, due to COVID-19 and the closure of schools, it became impossible to actualize implementation at the time we had planned, which was June 2020. I must emphasize that during the time that the schools were closed, we were still engaging the teachers with authorization from OPM, with authorization from UNHCR, but we were engaging the learners on a very, very small scale. Fast forward to 2021, when there was a partial opening of schools, we came back to the round table. What could we do at this time? Especially now we had a very little time to implement. We carried out a school exercise to find out what we could do. We had several engagements with the learners, we had several engagements with school management committees. You can imagine, to our shock, all the schools chose MHM as one of the first priorities we had to handle during that time. This, we realized there's a lot of stigma in Bidibidi. First of all, there's a collection of different cultures, different tribes, of course with the refugees and the nationals, and the perceptions are quite different about what menstrual health is all about. The issues stem from menstruation is dirty, it is unnatural, it is not something that can be talked about. In some parts of the settlement, once you talk about it, you are considered caste. Children cannot come out, women and girls cannot come out to engage or participate in anything while they are menstruating. And in other parts, there is a line, a category of activities that you cannot actually participate in once you're menstruating. Some of the women and girls are made to squat on holes. They actually make holes in a separate part of the community where you can spend your 3 to 5 days menstruating. We realized that over 5,000 learners had no access to menstrual products while at school. And this was also true at household level, because most of the partners were supporting at school level. When distribution went down, the teachers recorded learners missing 2 to 3 days of school time spent at home because of lack of access to menstrual pads. In the beginning, it never crossed our minds that menstrual health would become an issue. This was not on the plan at all. The project was totally redesigned when we understood that this is a very big and serious problem from the school assessment. We designed a training manual together with some partners, but it was also informed by the Swiss Water and Sanitation Consortium Learning Journey concept note. This was developed to support country teams in implementing the MHM activities in schools. Once we were giving the information, what next? Because even if you give the information, there's still an issue of access. This is when we introduced the pad making workshops, where we were training the learners and the teachers to make pads. However, we did not train the whole school. We transferred information. We would select a couple of teachers and the school heads and the boys. This is Knowledge Land Primary School, one of the schools, the Blue Schools, where the MHM intervention was implemented. We trained a number of teachers here, including the SMC and the school head, and Mr. Otim, who went ahead to be the patron of the school health club.
When HEKS came in, then they started teaching us about menstrual health within the school. It has been one of the challenging issues within our school here, where we enroll a big number of dropouts as a result of menstruation.
The key factors to note is the size, the absorbency rate, and this matters because there's issues of leakage.
Okay.
The pad can leak and then the child will get embarrassed, and that causes a psychosocial problem. The other key thing to put into mind is the usage, how these kids will manage the pad.
Okay.
And then the other one is disposal. For a reusable pad, it's about maintenance to effect durability. The pad that we'll make is 6 to 9 months.
When they came in and they gave us the knowledge about menstrual hygiene, we brought in both girls and boys, regardless of age. We all brought them together on board and we teach them, because we try to imagine that these boys that we have, they also have their sisters. Whatsoever thing that we teach them from here, they go and make practice within the community. They have also developed the skill of making pads. This project, one, I have acquired the skill. And not only the skill in the line of making pads, but I have learned administration. Through this, that is where I got my promotion. I became deputy straight away. I just found myself just because of my heavy participation that I gave time.
In the roles of personal hygiene to prevent us from getting diseases, which is known as contagious.
Home assistance, Yanguru, give that role of personal hygiene to prevent you from getting diseases, which is known as contagious.
All my sisters around, keep the rules of personal hygiene to prevent us from getting diseases, which is known as contagious.
In Yoko Primary School, the school administration has gone ahead to extend water into the rainwater harvesting tank that they acquired. This ensures that even during the dry season, they have water. This kind of initiative shows you that the capacity building element took effect, that the schools are able to take initiative by their own to make sure that they can do what they can do within the limited resources they have. And in the same school, they are working with the parents to put up a fund for MHM.
The most important here we really embraced was the issue of water. There was a problem of water, and when they gave us that tank, we connected the water to the reservoir which is nearby here. Now the water itself, the parents are benefiting from that, the school is benefiting, the community is all benefiting from the water which we've been connecting through the effort of HEKS EPER. When I first came here, the enrollment was 414, but right now, because of these activities, achievements, our enrollment has gone to 1,063. So all this we achieved because of this effort which has been brought by HEKS EPER.
And in Ariwa, the schools have gone ahead to work with the health centers to provide information to even the health centers about menstrual health. So they have this periodically where they will just go in and just give this information. The way forward for us, even through this documentation, is that we want to continue to break the silence, to focus on how many people really know what is happening in schools. We want to continue to empower as many menstrual health advocates as we can, so that it does not stop with Swiss Church Aid, but it is at all levels, so that there is improvement in menstrual health for children and learners. Swiss Church Aid Uganda, with the support of the Swiss Water and Sanitation Consortium, through our partner HEKS Uganda, worked with schools to empower teachers and learners with access to accurate information on menstruation and skills in pad making. We worked in Bidibidi refugee settlement and the surrounding communities in Zone 4 and Zone 5. HEKS EPER is collaborating with the government and CSOs to ensure continuity through combined advocacy efforts. A menstrual health management technical working group has been set up in Yumbe District, bringing together stakeholders to continue the work and the discussion on menstrual health management. At school level, teachers are working with parents and school administration to ensure improvement of menstrual hygiene for the girls in schools. This is being done through the setup of menstrual health management funds supported by parents and the prioritization from the capitation grant. The menstrual health management funds cater to essential MHM needs to allow the girl child to stay in school. We continue to break the silence.